Hi guys, today we are talking about peptic ulcer disease, and what this is we have ulcers or this damage to the stomach or the upper portions of the GI or of the intestines. So that's the kind of the portion of the GI tract that's affected here. So in general, some of the causes, it can be caused by Helicobacter pylori, frequent use of NSAIDs, smoking, and alcohol use. Diagnosis is done with an upper GI series, X-ray, or EGD, also known as esophagogastroduodenoscopy. Now for assessment, we're likely to see nausea and vomiting and abdominal pain. Now the abdominal pain is usually upper abdominal pain. It's often burning or sharp pain. Now depending on where it's located, it will present a little differently. Okay, so for a gastric ulcer in the stomach, the pain is going to be a gnawing or sharp pain and typically occurs 30 to 60 minutes after a meal. Now for a duodenal ulcer, a couple things might happen. We may see pain 1.5 to 3 hours after eating, but we may also see that pain is relieved by eating. Another thing that we might see in these patients is hematemesis. This is common with a gastric ulcer where the patient is vomiting blood. And for a duodenal ulcer, we may see melena, which is dark black tarry feces. Now let's talk a little bit about the therapeutic management. First, we're going to avoid things like aspirin, NSAIDs, because they increase bleeding risk. We're going to monitor H&H or hemoglobin and hematocrit and assess for bleeding. Medications, an H2 receptor antagonist, proton pump inhibitors, antacids, and sucralfate, also known as carafate, which you would take 30-60 minutes before meals, might all be used to help with this. And we have a few different surgical options as well. So the first one is called a vagotomy, where we're going to cut the vagus nerves. It decreases parasympathetic response, which will decrease gastric acid secretions. A second surgical option would be a gastric resection or gastrectomy, where we remove all or part of the stomach to remove the ulcerated tissue. And finally, we have the Bilirhoth. There's Bilirhoth 1 and Bilirhoth 2. We are removing a portion of the stomach here, and we're reattaching it in a Bilirhoth 1 to the duodenum and in a Bilirhoth 2 to the jejunum. And the last piece of therapeutic management is care post-op. For these patients, if they require surgery, we want to elevate the head of bed to 45 degrees. We're going to do only clear liquids for 3 to 7 days. And we're going to be assessing for bowel sounds. And then lastly, to help reduce the risk for dumping syndrome, which is this rapid influx of gastric contents into the small intestines, it's going to be really important starting out to avoid sugar or fatty foods, eat small meals, and don't consume fluid with meals. Okay, again, guys, this is peptic ulcer disease, where we're seeing these ulcers to the lining of either the gastric or stomach or to the upper portions of the intestines. It was great to chat with you guys today, and happy nursing. This has been another episode of NCLEX Flash Notes podcast, your no-fluff study companion for NCLEX success, providing exceptionally clear and concise content to conquer the NCLEX exam. Now, if you want to follow along while you listen to this show, you can head over to nclexbook.com to get our free ebook, NCLEX Flash Notes, with 77 must-know NCLEX nursing topics. And as a bonus, you'll receive 16 full-color nursing cheat sheets. Don't wait. Visit nclexbook.com today. That's NCLEXbook, NCLEXBOOK.com. Happy nursing!